Hello friends, this is Professor Dr. Sameen Afzal Junejo from Afzal Eye Clinic, Hyderabad, Sindh, Pakistan. Friends, I operated a case of a hard cataract, and I applied, in this case, I applied a technique of divide and conquer rule, because the cataract was so hard and I could not feel like doing through the stop and chop technique, because it was a hard cataract. After doing the capsular axis and full thickness 2-step surgical limbal through and through corneal incision and the formation of a side port incision, viscoelastic solution was injected. The setting of Phaco machine in this case was 65% Phaco, 550 millimeters of mercury vacuum and 40 cc per minute flow rate. Auto dissection was performed without hydrodelineation, because the cataract was grade 3 plus, rather on the contrary. OVD dispersive was used. Prior to do the Phaco emulsification. Phaco handpiece was loaded with easy tip, and with the bevel down, a central trench of about 1.5 millimeters was formed, and through the equator the nucleus was divided into two parts and then different small components, just like a cake slice. Remaining half of the nucleus was cut through the equator and divided into two halves by means of a cutting ball chopper, and again through the equator the hard nucleus was further divided into small components, total of about 8 pieces, and each piece was taken up one by one under a linear Phaco and high vacuum. The direction of the bevel was on the lateral side to avoid overheating of the corneal endothelium. The nuclear fragments were engaged at different sites so that their frequent and easy splitting into small pieces could be ensured. And now the epinucleus is being taken up on high vacuum without applying a Phaco power. So it consumed hardly not more than 2 minutes to remove the whole nucleus out of the eye and then in presence of OVD dispersive and two-way Simcoe irrigation and aspiration cannula, the part of the epinucleus and the rest of cortical matter were aspirated. And then, as the last component of the Phaco emulsification procedure, the one-piece foldable preloaded intraocular lens was implanted into the bag. So I would suggest my respected colleagues that if we get a hard cataract of grade 3 plus or even grade 4, we should always apply the technique of divide and conquer rule rather than following the stop and chop technique. The another name of divide and conquer rule technique is hammering technique. In this case, we applied the technique of divide and conquer rule, and now the viscoelastic material is being aspirated from anterior and also the posterior compartment of the implanted IOL. Which is the most essential component of the Phaco emulsification procedure. One should have a patience of removing almost the whole viscoelastic solution at the end of procedure. My dear colleagues, if you like this video, please subscribe my channel and press the like button and bell icon. Thank you very much. Have a good time.